Hello. Today we're going to talk about Medicare and Medicare Advantage and how they're different and which one might be the best choice for you. I have with us today an expert in that area, Devin Rubin. He's one of the principals in Golden Years Design Benefits, a family-owned business that's been around for 30 years. And all they do is Medicare, so they are the experts. So we've come to him to get the inside scoop on Medicare.
Great. Thank you so much for having me with your clients today, Nancy. We get the question all the time, is Medicare Advantage right for me? And that's a very personal decision. And I'd be happy to talk to you about some of the pros and the cons of Medicare versus Medicare Advantage. Let's jump into it, shall we?
Please, let's.
Medicare has a lot of rules and a lot of regulations. And so to understand how Medicare Advantage plans, it's very important to understand how the original Medicare program is set up. So let's talk about that first, if that's okay, Nancy.
Absolutely.
So on the screen, let's look at option one, which we'll call original Medicare plus a supplement. The way option one works is your insurance is through the federal government, and Medicare is going to pay 80% of your Part B expenses. And then if you have a supplement, it's going to pick up the remaining 20%. And so the benefits of original Medicare and a supplement are that they enable you to go to any doctor anywhere in the country that participates with Medicare. So you're going to have the most freedom, choice, and flexibility with option one, meaning you could really go see anybody that you want. If you do get sick or chronically ill with option one, you're going to have access to all the top providers, and your liability or out-of-pocket exposure is going to be quite limited to what your insurance premium is. And then after that, you're looking at an 80-20 cost share, which is, for many, a very good thing.
Very good. And is that the same thing that Medicare Advantage offers?
Medicare Advantage works differently than original Medicare. And so, our phone rings off the hook every week because, our clients that work with us are seeing the Joe Namath commercials on TV that are touting some of the benefits of Medicare Advantage. So I think it's important to understand the pros of why a Medicare Advantage plan might be right for you, and then maybe some of the cons, or maybe some of the things that you're giving up that you may not get with a Medicare Advantage that you would with your current program if you're on original Medicare and a supplement.
That's very helpful because, when you hear about it on TV, there's so much in there that you'd be crazy not to do it. So we need to know the pros and cons of both programs.
So let's talk about the pros of a Medicare Advantage plan. So first and foremost, one of the terrific things about the Medicare Advantage plans today is that, at least here in New Jersey, most plans offer a zero premium plan. So that's going to be in contrast. If you have a Medicare supplement plan, you have to pay an insurance premium to have it. With a Medicare Advantage plan, these can be very attractive to people that are on a fixed income because you don't have a monthly insurance premium. One thing to remember, Nancy, is that you still have to pay your Medicare Part B premium, irrespective of which program you choose.
Okay, that's good to know. So the 144 is the same on either side, or the 148, but you're paying a premium for your supplement on the traditional Medicare.
That's correct. The way Medicare Advantage works and how it's different is, instead of the federal government or Medicare being your primary insurance, you're basically opting into the private insurance company's rules and regulations, co-pays, co-insurance, deductibles, and their network. And that's a big difference between option one and option two. So let's talk about that a little bit. If you're a senior and you don't go to the doctor very often, then Medicare Advantage could be right for you. But if you're somebody that has grown quite fond of your doctors and you want to have the choice and freedom to go see any physician, any hospital, and anywhere in the country, you might have more restrictions on a Medicare Advantage plan.
What are some of those restrictions?
In order to gain access, the physician must be willing to bill that Medicare Advantage company. If they're not, then you could have some more headaches in terms of gaining access to care and having claims paid for. And generally with original Medicare and a supplement, claims are run through the system very smoothly. The claim is submitted to Medicare. Medicare is going to pay the 80%, and then Medicare sends that over to the supplement company. And you don't really see those claims. With Medicare Advantage, if your physician is out of network or doesn't participate with that doctor, then you're going to have trouble seeing that physician and certainly more headaches.
So it's a zero premium plan, but at some point you have to pay a deductible and a copay, I assume.
With Medicare Advantage, it's more of a pay as you go, right?
Okay.
So in return, you're not paying a zero premium, but you're going to have co-pays, deductibles, and co-insurance for all the medical services that you utilize. If you go into the hospital, you'll pay maybe a $300 copay per day. If you see a specialist, you might pay $20 or $40 for that visit. But really where the major liability could be on a Medicare Advantage plan is if you get chronically ill, and let's say you develop cancer and you need chemotherapy treatments, you're going to pay 20% on those items up until the maximum out of pocket.
What is the maximum out of pocket? How does that work?
So on a Medicare Advantage plan, there are rules and regulations. And in New Jersey, the maximum out of pocket is between $6,700 and $7,500 a year. So they cap you, the private insurance company is going to cap you up to $7,500. So if you develop cancer and you needed chemotherapy and radiation, you'd be responsible for the 20% up to that maximum out of pocket.
Did you say annually?
And this is an annual out of pocket cost. So if you get sick in the third or fourth quarter, that maximum out of pocket is going to reset on January 1st.
Wow. Okay. So if somebody's been going along happily on Medicare Advantage and then their health goes down a little bit and they decide they want to switch, is that a possibility?
So you have 1 year. If you've never been in a Medicare Advantage plan and you've enrolled in it and you get sick, the government says you have 1 year to go back to option one. That's called your Medicare Advantage trial right period. After that year, there's going to be rules and you would have to qualify for that Medicare supplement policy and you may not be able to go back.
Well, this has really been helpful. I understand a lot more about these two programs now. Thank you very much for giving us this information. And I will put your contact information into the email that goes along with this so people can contact you and get a review or answer further questions of things you haven't been able to answer now. So thank you.
You're welcome, Nancy. And it's really important if you're considering going from option one to option two to really understand the pros and the cons of both programs. And if you're paying more than you think you should be on option one, there are options where we could potentially lower your premiums by looking at another insurance company. And if you say, Devin, listen, I just can't afford a Medicare supplement option anymore, then we could explore how a Medicare Advantage plan could fit into your lifestyle and pick the best plan for you.
Thank you so much.